Come in.
Hey, Henry Smith's here. Are you ready for him?
I am. Come on in, Henry. Have a seat. Henry, I'm Amy. I'm the pharmacist. I've worked in the anticoagulation clinic for over 10 years here, so I'm going to be working with you today to get your INR reading. I can see from your chart, it looks like you're currently taking Coumadin, and your INRs have not been very consistent. Does that sound right?
Yeah, that sounds about right.
Can you tell me what's going on?
Well, I've been having a few issues. About 2 years ago, I went on a road trip with my friends for my 25th birthday. We were driving along the East Coast for a 2-week holiday. At the end of the trip, I started experiencing pain and swelling in my left leg.
Oh no.
When I returned home, I went to the emergency room and the doctor told me I had a DVT and I was admitted to the hospital.
Okay.
I was on medication to prevent further problems and was doing fine, but I had a second DVT about a month ago.
Okay.
This was the worst time that it could happen because I'm getting married soon, and this is very stressful. What makes it worse is that my INR has been inconsistent, and I keep having to come back for follow-up.
Oh, I understand what you're saying. So it sounds like things were going pretty well up until recently. So can we talk a little bit more about if there's been any changes in your medications, maybe either prescription or over-the-counter therapies, and whether there's been maybe, I don't know, lifestyle changes or diet changes in the past week?
Well, my only prescription is for Coumadin, and I routinely take this every morning.
So in any given week, how many times do you think you miss a dose?
I never miss a dose. I know how important it is to stay on this medication, and I rarely ever forget to take it. To remember, I set it on the counter in the kitchen by my Keurig, so I see it every morning.
Oh, that's perfect. Well, I'm looking at your chart here. It says, is it Coumadin 5 milligrams? Does that sound correct?
Yes, that's correct. The doctor told me to wear graduated compression stockings and encouraged me to walk more. So I'm preparing for my wedding, and I am doing a paleo diet to help me lose weight and to get chiseled.
Ooh, the paleo diet. Tell me a little bit more about that. Like, what types of foods are you eating on the paleo diet?
I'm eating a lot of fruits and vegetables. For protein, I eat steak, chicken, fish, or some other type of seafood or eggs.
Okay. Well, I like the protein part of it. You said a lot of fruits and vegetables.
Yes.
Is there a way you could tell me just a little bit more about this?
It varies. Sometimes I prefer one type over others. I like broccoli, Brussels sprouts, asparagus, and green beans. For fruit, I like kiwi and blueberries a lot. I've also been making a lot of pumpkin recipes this fall for Thanksgiving.
I love pumpkin as well. All right. Well, it sounds like the paleo diet's, you like the paleo diet, correct? It sounds
Yes.
like that's maybe working well. All right. Well, with that in mind, let me get the INR checked, okay?
Okay, that would be great.
All right. All right. Thanks, Henry. Well, it looks like the INR came back at 1.8, which, as you know, is a little bit lower than we would like. So even though you've been taking this Coumadin consistently, I think that new paleo diet is really affecting your INR. You know, your physician's assistant office is right around the corner.
Okay.
Do you mind if I go and run over to talk to your physician assistant? I know diet sounds like is important for you right now, and it looks like coming into the visits is a source of stress as well. I would just like to discuss some other treatment options with your PA.
Yes, that would be fine.
All right.
Hi Amy, how are you doing? I was just stopping over to check on Henry Smith since lately his INRs have been inconsistent.
Yeah, Carter, that's why I was trying to find you. His INR today was 1.8, which is a little bit lower than we'd expect. You know, he mentioned he's preparing for a wedding and is currently doing the paleo diet. Paleo diet's really high in protein and a lot of fruits and vegetables. So those high fruits and vegetables are causing higher vitamin K intake. In addition, coming to the INR and getting it checked pretty frequently is causing a lot of stress in his life. So with all of those factors in mind, would you consider switching Henry maybe to a direct-acting oral anticoagulant? You know, Henry was really adherent with his once-daily Coumadin regimen. And I looked, and actually his insurance will cover one of these newer agents.
Oh, yeah, sure. What about his renal function and any drug interactions?
You know, Henry's only taking Coumadin currently, so he's not on any other medications. And his renal function is great, so we'd want to avoid edoxaban. Since he mentioned he's preparing for his wedding, I really think a once daily option is going to probably fit best with his lifestyle.
Oh, a good idea. How about rivaroxaban?
Sure, the dose of rivaroxaban would be 20 milligrams once daily. And knowing that his INR today is 1.8, we could actually just stop the warfarin and transition immediately. Would you be willing to write an order for that transition?
Sure. I can enter the order now, and we can let the patient know together. Could you provide the education, please?
I would be more than willing to do that, Carter. Thank you. Hi, Henry.
Hello.
I spoke with Carter, your physician assistant, and we discussed your medication. I brought him into the room so that we can discuss what our treatment plan maybe is.
Hi, Mr. Smith. My name's Carter. I'm the PA. How are you doing?
Hello. I'm doing okay. I'm a little frustrated with my INR though.
Okay, well, we had a discussion, and we think that we'll have a new medication that can allow you to keep up the diet, but also to make your life a little easier as well. And want to discuss that?
Sure.
Come in.
Take two.
Okay, well, we've been discussing, since you're doing the paleo diet, something we can do to help with your medication. So we've come up with a plan that can help you keep your diet and also help, provide what was it? I don't want to say therapy. A little easier, make your life a little easier. Sorry.
All right, let's do another.